Really appreciate all of you being here on a kind of a slightly windy, threatening kind of evening to learn a little bit about child abuse. And when Rabbi Bach and Tuvia and Rabbi Milstein came and asked me if I would talk about some child abuse issues, and eventually they kind of wanted to know, well, what would I talk about? I kind of thought about it for a few seconds, and I thought, you know what, I just want to talk a little bit about the effects of child abuse and like why we should care and why I think of child abuse as a public health problem. I think many of you think of child abuse and neglect and maltreatment as a social problem, as a societal problem, maybe a legal problem, a family problem. But in my kind of small medical community, we really think of child maltreatment as a public health problem. And so that's what I want to share with you for maybe the next, 15 or so minutes. So here's just a beautiful baby, okay? This is a generic, beautiful child. And this child has his or her whole life ahead of him. The sky's the limit. If he's nurtured, if he's educated, if he's cared for, if he's treated well, okay? But this child's life may lead to this as an older man. Now, this is a generic older man, okay? And I don't know this person, but we could all imagine that this person has had a very difficult life, that maybe this person has struggled with mental health disease, maybe this person has struggled with substance abuse or homelessness or other kinds of medical diseases that make him what appears to be not a healthy person. And so when I think about child maltreatment, I think what makes a young, beautiful, healthy infant kind of eventually become a troubled, unhealthy adult, okay? And that's what I want to share with you this evening. Now, I know that a few of you are familiar with what we call the ACEs studies in medicine, but most of you are probably not familiar with them. So I want to just kind of talk a little bit about these studies. This is a series of publications on studies that were done by the CDC in conjunction with the Kaiser Permanente healthcare system. And what they did, first of all, when you're enrolled in California in the Kaiser Permanente healthcare system, they gather and they have a lot of important healthcare data about you because you're enrolled in their insurance plans and in their practices. And a group of researchers, Vincent Folletti, Robert Andis, and others, sent out surveys to tens of thousands of adults who were enrolled in the Kaiser Permanente healthcare system and asked them about different exposures that they had during their childhood. And they didn't say, were you a victim of child abuse? They asked questions about how you were treated and questions about your family household. Was there domestic violence in the household? Was there substance abuse, mental health disease? Was there a parent who was incarcerated? Were you a victim of physical, sexual, or psychological maltreatment? And they had a number of different, what they called like adverse childhood experiences, like the evils of childhood. And there were, depending on how many you wanted to count up, there were about 7 or 9 of these adverse childhood conditions. And so they gathered all of their survey results. And then they looked at how many of these adverse conditions each person had acknowledged and gave them an ACE score, adverse childhood experience score. And if on your survey you got a 0, meaning that you had not been exposed to any of these terrible childhood adversities, then you got an ACE score of 0. Or you could, if you were exposed to 2 of them, there was substance abuse in your parents and you had been sexually abused, you got a 2. If you had experienced all of them, you may have gotten an 8, okay? And then what they did was they looked at kind of indicators of adult physical health and compared them to reports of childhood adverse experiences. And I want to show you some of the associations between these ACEs and adult health indicators. Okay, so that's that. Before I do that, though, okay, I want to say this, that if you look at these numbers, the majority of adults in the Kaiser Permanente system, and these are adults who are working, they have private health care, they're doing pretty well, more than half of them had acknowledged at least one ACE in their childhood. And if you had one of these exposures, it was more likely that you had more than one of these exposures. And I think that that's important, that these are common, more common than many of the diseases that we learn in medical school and in residency and when we're out in practice. These are common, okay? And if you look at individual ACEs, what people responded to, you can see that more than 20% of individuals acknowledged having been sexually abused during their childhood. That is an incredibly high number, okay, for people. And again, you can see all of these problems are really very common in households, in communities, not only in California, but around the country. And now I want to just share with you some of the associations, because what you see is very clear and very powerful associations, that as your ACE score as a child goes up, so as you have been exposed to adversity in childhood, household and family adversity, there are increased rates of smoking in adulthood. And so one can imagine that there might be increased rates of lung cancer in adulthood. There are increased rates as your ACE score goes up. The rates of alcoholism as an adult goes up, okay? And it's not like all over the place. It is a steady, clear association. As ACE scores go up, rates of chronic depression for both men and women increase and increase steadily. As ACE scores go up as a child, the likelihood that you have attempted suicide as an adult goes up. The likelihood that you have had more than 50 sexual partners in your lifetime, and the likelihood that you have ever contracted a sexually transmitted infection goes up as your ACE scores go up. Heart disease increases, okay? Heart disease, that's a leading cause of morbidity and mortality in adults in American society. As ACE scores go up, heart disease rates go up. So that no matter what we look at, there are impacts on physical and emotional and behavioral health that have their beginnings not in kind of a molecular disease, so to speak, but in your experiences, your childhood experiences. Okay? They affect all of these things. They affect rates of cancer, liver disease, skeletal fractures and osteoporosis in older women, issues of sexual health, teen pregnancies, sexually transmitted infections, mental health, I think would probably be obvious to many of us, general health and social functioning, and all of the other things that we associate with having kind of serious and challenging childhood experiences. The only thing that doesn't go up, and this is a little bit complicated, but I'll explain it in a minute. The only thing that doesn't go up with ACEs is how long you live. So if you look at the cohorts that they questioned, and if you look at the 0, if your ACE score was 0, you see the pink line is very high. Those are the individuals who were over the age of 65 who sent back reports, who were surveyed and were able to send back reports. And when you get to ACE scores of 4, there are very few 70-year-olds, 75-year-olds, and 80-year-olds who responded to the survey, probably because many of them have already died of the heart disease and the cancer and the lung disease and the suicide and the drug addiction that plague them as adults. And when the researchers initially kind of put out all of these studies, and there are many of these studies, they kind of built this pyramid to explain this association, right? How does somebody sexually abusing you as a young child end up with higher cancer rates or heart disease rates or other inflammatory diseases, autoimmune diseases? And so they postulated that, you know, these experiences lead to some social and emotional and cognitive problems. And then when you become adolescents and young adults, you make poor choices, you hang out with the wrong people, you begin to do things that are bad for you, and then you get disease. but we've come a little bit of a way, really, from that kind of pyramid model. And so I want to spend just a few minutes thinking about, really, how does adversity in childhood translate into biological poor health as an adult? And this is really an emerging area of medical investigation. Now, we probably all can relate to this slide, okay? I can relate to it, okay? We're all stressed, okay? But, you know, there's stress and then there's stress. And some stress is actually good for you, okay? We, as pediatricians, don't believe that children should lead a stress-free life, okay? That's a sheltered life. That's a life where you're not prepared for the world, okay? Some stress is good. It makes children a little resilient. It allows them to go out into the world and tackle things. You know, I have a college student. She's stressed. She has too much work. I'm so tired. I'm like, okay, so you're stressed. Next week you won't be stressed, okay? Like, that's life. We've got a lot to do. We're busy. But that's good stress. It gives you a little resilience, and it you know, makes you a stronger person. It's a good thing, okay? Now, we also have stress that is really a little bit more serious, but it could be tolerable. So that's the stress that might come if you're a child and you have a parent who dies, or your parents are divorced, right? Those are really difficult stresses for children. But if these children have other adults who can really support them and embrace them and nurture them and help them, okay, then they can make it through that stress in a meaningful way. It might not be easy, but it's stress that can be tolerable. But when we see children who are living in households where they are abused and neglected, where there's family violence and domestic violence, where their parents have terrible mental health disease, where they're substance addicted, then they have what we have termed in medicine toxic stress. It's that unrelenting, unremittent stress, okay, that really can affect your body in negative ways. Think about how your body sometimes reacts when you're stressed, okay? And we'll talk just a little bit about that. So our bodies and our brains are kind of built to react to high levels of stress. Okay, if you have ever been in a car accident, or if you've ever been in a dangerous situation, you know what happens. Your heart starts to race. You're ready to rev yourself up. It's that fight or flight response that you have, right? Your brain, the areas of your brain that have to be activated to save yourself from the lion that's going to come and get you, or the bear that's going to eat you, or the robber that's going to rob you, go into action. Now imagine you're a little kid, okay, and you live in a household where you don't know when the next time a parent may snap and beat you, okay, not because of what you did, but because they're stressed, okay? You are going to kind of get revved up. Those areas of the brain, the amygdala, the limbic system that control your emotions, are going to be activated. And especially if you're a young child whose brain is still developing early in childhood, there's evidence now that those areas of the brain that are exposed to these high levels of unrelenting stress become hardwired in a way that we don't want them hardwired. We want children to be relaxed so that their cortex can learn, so that they can develop, so that they can go to school and be successful. But for some children who are living in toxic, stressful environments, ooh, what happened there? Okay, are not using their whole brain. They're using the survival parts of their brain. And those are the parts that are being wired. And then what happens is every time a child is in a situation where they think it's stressful, where they think that they are in danger, they begin to rev up. So they may be in school and a teacher may reprimand them for talking out of place or for not doing their homework. And they are threatened in a way that we don't expect them to be threatened. And they respond in a way that we don't expect, okay? They go into fight or flight mode, okay? And that kind of begins this cascading problem for them. So we talked a little bit about fight or flight. But it's not only your brain that's involved with that response, right? I said your heart rate goes up, you know, blood flow to your stomach, into like the other areas you don't need go down, right? There are hormones that are involved in this. And so all of these hormones are activated when children are stressed. And, you know, it's a complicated system, okay? But there's actual biological consequences of living in environments that are this stressful. Cortisol levels go up. And when cortisol levels are chronically elevated, you get autoimmune problems, you get immune difficulties, you get elevations, for my doctors out in the audience, of your CRP levels. I mean, things change in your body, and it leads to medical diseases. So this trauma has significant impacts on the developing brain. Not the changes in your brain lead to insecure attachments. These are the things that Judge Wolf sees in her courtroom, probably year after year after year. Hypervigilance on the part of children. When is the next danger coming from? How can you focus on learning mathematics if you're thinking that somebody's going to attack you any minute now? Okay? Hypervigilance, poor self-concept, inflexibility, and difficulty in managing transitions. For those of you who are experts in school, okay, and in education, you see these children. These are problem students. These are the kids that don't make it through school, okay, and then they don't make it as healthy adults. And then to make matters even more complicated, there is emerging science to suggest that these influences, especially early in life, they do not change your DNA, but they have the potential to change how your DNA is interpreted and read. And we call that epigenetics. And that these influences are potentially inheritable generation to generation. So I may see a parent and think, why is this parent behaving in such a way? Why is this child, and then the parent, it's like, you know, over and over, generation after generation. It may in fact be biologically based. Okay? So, adversity leads to poor health outcomes through toxic stress, through changes in your neurological development, through your immune system, through hormones, and through epigenetics. Okay? And again, this is it's a bad cascading problem, because you've got kids who are affected, who behave differently, who get in trouble, and then they get hurt again, and it reinforces that, and people don't understand them, and we can't understand why they're having difficulty, why they can't behave, why they can't cooperate, why they can't learn, why they can't be good kids, okay? And this is really becoming kind of a focus of a lot of basic research in pediatric care. So this is not really only a social problem. It's not only a legal problem. It's not only a child welfare problem. It's a health problem, okay? And so child maltreatment is a leading cause of toxic stress, which leads to poor adult health outcomes. And in fact, many adult diseases have their origin in early childhood. One of my dear friends and colleagues likes to say, not every child has been an adult, but every adult has been a child. And that's where all of these diseases start. And that's why I'd like to say that child maltreatment is a public health problem. And so I am happy to stand up and talk a little bit, any chance I get, about the importance of having a focus not only on kind of the safety and permanency for children who are victims of child abuse, but also to think about the effects that this have on their health care. And that's what I'd like to share with you today. Okay, I'm done, and I'm going to sit down and then take questions later.